Hi, I'm Robin Patel. I'm president of the American Society for Microbiology. I work at Mayo Clinic in Rochester, Minnesota, where I'm a professor of medicine and microbiology, chair of the Division of Clinical Microbiology, and director of the Infectious Diseases Research Laboratory. Coronaviruses are a large family of viruses. They're pretty common in people, and they usually cause just the common cold. They're also found in many different species of animals. Very rarely, animal coronaviruses can move into people and infect people and then be spread between people. And examples of coronaviruses that have done that include what we call MERS coronavirus, which stands for Middle East Respiratory Syndrome coronavirus, as well as SARS coronavirus, severe acute respiratory syndrome coronavirus, and the one we're dealing with now. The one we're dealing with now is called SARS Coronavirus-2, and the disease it causes has been named Coronavirus Disease 2019, abbreviated COVID-19. All of those things are really the same thing. SARS Coronavirus-2, or SARS-CoV-2, is a beta coronavirus like MERS coronavirus and SARS coronavirus, and all three had their origin in bats. SARS coronavirus circulated in the year 2003. It caused about 8,098 infections and 774 deaths. MERS coronavirus has infected 2,494 individuals and caused 858 deaths. And as of today, SARS coronavirus 2 has infected over 150,000 individuals and caused over 5,000 deaths. We first saw this virus in late 2019 in Wuhan, China. SARS coronavirus 2 spreads very easily from person to person, and that's why it's spreading so quickly. It spreads between people who are in close contact with one another within about 6 feet through what are called respiratory droplets. These are produced when someone who is infected with the virus coughs or exhales. Those droplets will travel a very short distance, and that's why just 6 feet, and then they'll drop down onto surfaces around that patient. It's also been detected in other specimens like stool and blood, but those are not currently felt to play a major role in transmission. And airborne transmission, that is prolonged suspension of viral particles in the air, is also not currently considered to be a major driver. So because it's transmitted person to person, most transmission that we see is in people who are very close to one another, such as in households on cruise ships that you've probably heard about, or also in healthcare facilities where healthcare providers are caring for infected individuals. There are several ways you can protect yourself from SARS coronavirus 2. The risk of being exposed to the virus is currently low for most Americans, but as the outbreak expands, this risk is increasing. Cases and instances of community spread are being reported in a growing number of states. People in places where there is community spread of the virus, and again, this is changing over time, are at elevated risk of exposure. And the risk is therefore dependent on exactly where you are. As I mentioned previously, healthcare workers who are caring for patients who are infected with this virus are at risk of exposure. And then travelers coming back from international locations where community spread is occurring are also at risk of exposure, with the level of risk dependent on where they traveled. The incubation period, that is the amount of time from being exposed to the virus to developing symptoms, ranges from 1 to 14 days and is most commonly 5 to 6 days. In some rare cases, it has been reported to be longer than 14 days. So it's a range. Most people, about 80%, will have a mild to moderate illness. That is, they'll have some fever and dry cough. It'll last about 2 weeks and then they'll get better. About 14% will develop severe illness and 6% life-threatening illness, life-threatening with respiratory failure, septic shock, and organ failure. So overall, the most common symptoms are fever, dry cough, as well as fatigue and myalgias. That means achy muscles or feeling achy all over. Some other symptoms are less common, but can occur: runny nose, headache, sore throat, abdominal pain, and diarrhea. The most worrisome outcome of this infection is pneumonia. So when the virus goes down into the lungs and infects the lungs, that's pneumonia. And if that happens, it typically happens around the end of the first week of infection to the beginning of the second week. Again, that's the most severe manifestation of this infection. If you think you have symptoms of infection with SARS coronavirus-2, here's what you should do. First of all, the symptoms associated with this virus are not any different than symptoms associated with other viruses. So you can't tell just from your symptoms that you have this specific virus. Other viruses that are circulating at this time, like influenza virus and adenovirus, can also cause similar symptoms. I just explained that this virus is transmitted person to person. So what you don't want to do is infect other people. So you want to stay at home. Don't go into work. Don't go out into public places. Call your healthcare provider for advice and stay put. The only exception would be if you're severely ill. If you have emergency warning signs, you need immediate medical attention. Examples of emergency warning signs include very severe difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or new drowsiness that's unexplained, or blue lips or a blue face. So if you're really concerned, seek care immediately. Otherwise, sit tight and contact your healthcare provider for further guidance. Many people have been around people who have respiratory symptoms. As I mentioned, respiratory symptoms can be caused by a number of viruses. So just because someone around you has symptoms doesn't mean they have this virus, SARS Coronavirus-2. I think in a case where you're worried about exposure, you really need to assess the situation on an individual basis, based on details of exposure and local spread of the virus. If this is happening, for example, in your place of work, you should seek help from your supervisor at work and look for additional guidance from them. The most vulnerable population for this particular virus is those of older age and also those who have serious chronic medical conditions such as heart disease, lung disease, or diabetes. The best way to prevent acquiring this virus is to not have contact with someone who has this virus. And that's where social distancing comes in. It's a term that's applied to actions by public health officials to stop or slow down the spread of a highly contagious disease, which this is. Social distancing measures restrict when and where people can gather to stop or slow the spread of infectious diseases. Such measures include limiting large groups of people coming together, closing buildings, and canceling events, as well as deliberately increasing the physical space between people to avoid contracting an illness. Staying at least 6 feet away from other people lessens your chance of catching this virus. Some examples of social distancing, many of which we've seen playing out in this outbreak, include working from home instead of your office, closing schools or switching to online classes, visiting loved ones by electronic devices instead of in person, and canceling or postponing conferences and large meetings. Staying at home and social distancing are important even for groups that are not high risk. Anyone can become infected and anyone can transmit this virus to someone else. What's trying to be done is to prevent the spread of the virus. And so people who have minimal symptoms and even people who have no symptoms but are infected can transmit this virus. A low-risk individual or someone who has minimal or even no symptoms can pass the virus on to someone who is high risk. That's what's really concerning about this. The person may not feel sick at all, and yet they can be a vehicle for passing this virus to someone who's going to get very sick or even die from this virus. This is a respiratory virus. So if we're going to test for it, we need a sample that comes from the respiratory tract. Most often, this is what is called a nasopharyngeal swab. It can also or additionally be tested for using a throat swab. And for patients who have pneumonia or involvement in their lungs, we'll test lower respiratory secretions like sputum, for example. So there are a lot of different specimens. I've noted confusion about what testing means when I hear about what's going on with the general public. Testing seems to some to mean getting a test done or getting a specimen collected, but I'd like to clarify that there's much more to testing than just collecting the specimen. The actual testing for this virus and for many other infectious diseases is done in clinical microbiology laboratories. Testing in a laboratory is a complicated process. The virus is an RNA virus, so tests are designed to pick up the specific RNA of this virus and not other viruses or other coronaviruses. Before this outbreak, we had no test for this virus. We actually have tests for some coronaviruses, but they don't pick up this coronavirus. So clinical microbiology and public health laboratories had to develop their own tests. Today, we also have tests made by companies and sold to clinical microbiology or public health laboratories to perform. In all these tests, there's a first step where RNA of the virus is extracted from the patient specimen, and then a second step where the RNA is converted to DNA, and a third step where the DNA is amplified with DNA primers that are specific to SARS-CoV-2. This is not a trivial type of test. It needs to be performed by trained laboratorians to make sure that it's done correctly. Introducing this type of testing into a laboratory is complicated. It requires validation in that laboratory to show that the test works correctly. And if it's developed by that specific laboratory, that development needs to be done in that laboratory. This is a field of science that a lot of people have never heard of, called clinical laboratory science. Once the test is being run, there's a lot of quality control involved, including testing positive and negative samples with every run, and then doing proficiency testing by periodically checking the system to make sure it works. For example, by sending through blinded, well-characterized samples to make sure that the laboratory gets the correct results. Laboratories that do this kind of testing are used to doing it day in and day out for many infectious diseases. This is a new one, obviously, so the tests being used are all new tests. Once the test is done in the laboratory, then the results go out through a computer, something in the laboratory that we call the laboratory information system. They go then to the patient's electronic medical record and are available for viewing by healthcare providers and in many cases for patients to see as well. There is another way to test for the virus indirectly. We can look for antibodies to the virus in patient's blood, but they don't develop right away. So this type of testing is not useful early on. It can, though, tell us who has been infected with this virus in the past and who hasn't. There has been a lot of concern about the lack of availability of tests. As mentioned, this is a new virus, and we didn't have any tests for this virus. So the tests that are out there had to first be developed and then validated and then made available for patient care. The situation is improving day by day. State and local public health laboratories in 50 states and the District of Columbia are offering testing, and testing is offered through many clinical microbiology and reference laboratories as well. Not everyone with symptoms needs to be tested. The people who need to be tested are those who are severely ill and are hospitalized, because we need to know whether they have this infection or not for their management and also to protect healthcare workers. In more mild cases, it may not make a difference. It can make a difference in terms of knowing whether a person needs to be quarantined or not. And also in tracking spread of this virus, but we don't have any treatment for this virus. So the management is not necessarily dictated by knowing for sure that they have this virus. At the end of the day, your healthcare provider should advise as to whether or not you should be tested. Criteria for getting a test will vary depending on where you live and the availability of testing. The most urgent need is to test hospitalized patients to manage them correctly and get them into proper isolation to avoid transmission in healthcare facilities. If available, testing can be used for outpatients with symptoms consistent with infection. Testing those who are well is not routinely recommended. If you test positive for SARS Coronavirus-2, you should stay home and avoid infecting others, and you should contact your healthcare provider for advice. If someone you've been around tests positive, you should seek advice from a healthcare professional, or if, for example, you're at work, from your supervisor. We don't know what's going to happen in the future with this virus. It's a new virus. We've never seen it before. And so it's really hard to predict what it's going to do going forward. There is some limited evidence based on unpublished data in macaque experiments, that's a kind of animal, that there could be protective immunity. That is, that a human who had this infection might be protected against it if they get exposed to it again, but we don't know that for sure. There has been speculation that it might go away when the weather gets warmer in the northern hemisphere. We don't know if that's going to happen. It does happen with some respiratory viruses, so it's possible, but we really don't know. And if that does happen, which again, we don't know if it will happen, we also don't know whether it would come back again. Theoretically, it could change and come back again and infect people who have had it before. But again, we just don't know. Unfortunately, we have no specific treatment for this and no vaccine, and that's because this is a new virus. There's a lot of work going on trying to develop a vaccine. Vaccines are very important for preventing infectious diseases, but again, for obvious reasons, we had no pre-existing vaccine for this virus. There are several vaccines now that are under development, but it will likely be several months before we see any of those become available. As far as treatment, there are several treatments that are under investigation now using scientific methods to see if they make a difference in patients who have severe infections with this virus. I think we'll learn a lot over the next few weeks and maybe months with this virus as far as what might work or not. Some of them are antiviral agents or antiviral drugs, and there are also studies going on with antibodies against this virus that come from those patients who have been previously infected with this virus. ASM's mission is to promote and advance the microbial sciences, and this pandemic is square on target with ASM's mission. ASM brings together many world experts in microbiology, including basic science and clinical virologists, clinical microbiologists, epidemiologists, infectious diseases doctors, and scientists working in therapeutics and vaccine development. The value added by ASM is that of serving as an authoritative, trusted source of evidence-based scientific information. ASM is playing a fundamental role in advising the highest level of government in this crisis, bringing into focus the needs of experts on the front line and actively proposing and collaborating to implement solutions. Finally, ASM is one of the largest publishers of microbiology literature in the world, with a 17% share of the world's microbiology articles and a 44% citation share, providing a fundamental venue for vetted and sound scientific communication.